All right, it is 6 o'clock Pacific time, 8 o'clock Central, 9 o'clock Eastern. Welcome everybody to the CARIE Health Business Opportunity Presentation. My name is Jeff Giammalva, and my wife Lisa and I are the Vice Presidents of CARIE Health. And we are very excited tonight to be able to share with you a business opportunity that really people can take advantage of. And here's why we believe we have an unbelievable opportunity. CARIE Health has identified a problem. It's called healthcare. And what they're doing is they're helping solve the healthcare problem. And there lies the opportunity. So the purpose of tonight's call is strictly to give you information. Because I know we have people that will be logging on all around the country. And some people out there today are working full time. And they want to start supplementing their income. But here's the number one problem they have. They don't have time. So CARIE Health has a system where a full-time person could plug in and leverage our system. Some people want to replace their income. And there's other people that want to become financially independent. All of the above exist here at CARIE Health. But right now we are in what we call a pre-launch phase. During this phase, we're looking to identify people that have the ability to see something before it happens. This is a very unique time within our company, and we need a very unique individual that has the ability to see it. And no better person to kick off our business overview to get you to see why CARIE Health is going to change lives than my partner and, more importantly, my good friend, Mr. Lou Gallardo. Now, I'm going to give you the introduction of Lou, and then we're going to do our income disclosure. Lou and Paula, his wife, and my wife and Lisa, we go back 25 years. First of all, we met Lou. He was a top earner in a network marketing company. This is 25 years ago, guys. And we admired Lou and Paula from afar because we were just getting started in the industry. They went on to start their own company, and their secret to success, their secret sauce, was showing physicians how to implement a nutritional supplement program into their practice. We watched from afar, and then we joined him in that endeavor. And we became the #1 income earners for his company. Since then, Lou and his partner Greg have went on in healthcare and built 2 $100 million companies in the last 5 years. So no better person to really share the vision than Mr. Lou Gallardo. But before I bring him on, I want to make sure our company stays compliant, because we're going to have unbelievable success stories that come from this opportunity. And as always, practicality dictates that everyone's results will vary, as we are all unique and different. And basically, it takes hard work to make a substantial income in this business, and some people will make no money at all. The earnings of a CARIE virtual care consultant will be 100% dependent upon their skills, work effort, leadership capabilities, and market conditions. And common sense would suggest that in most opportunities, one would find exceptional individuals performing well above average, while others perform under the average. CARIE does not guarantee any level of income or your success. And of course, this does not account for any business expenses that one might incur while building their business. My favorite slide, let me tell you why. Because now that we shared with you this, we can now share with you the other side. What could be earned with some hard work and dedication? So to kick off the overview, okay, my good friend, business partner, and entrepreneur, Mr. Lou Gallardo.
Thank you, Jeff. It's always a pleasure to be here. I hope everybody is enjoying their summer vacation with their friends, their family. I certainly have with mine. And I just want to hopefully share some information, share some knowledge, and what I think are some incredible facts on why CARIE Health is the next company to actually, I know the word has been used a lot, but disruptive. but I do believe that CARIE Health is disrupting the whole healthcare community in an incredibly positive way. As Jeff mentioned, I've been very blessed, myself, my family, to have been in front of, or been able to position myself in front of some significant trends in business, particularly in the healthcare space. I love healthcare. Obviously, healthcare is an industry that is a massive business. We're looking at $4 trillion of income or revenue that this industry is in the process of building or generating. All experts believe that it'll be 25% of the GDP, or $5 trillion by the year 2025. And as Jeff mentioned, it's unfortunately, in many cases, it's a crisis, because we have some problems. The United States ranks 37th of all industrialized nations in terms of our overall quality of health in this country, even though we have expenditures more than 3 to 5 times any other industrialized nation, the closest nation in terms of expenditure. Unfortunately, the cost of healthcare is rising at a rate that is really becoming frightening. When you've got any one industry that is responsible for 20 or 5% of the GDP, that's a significant industry. And we're just not getting a big bang for our buck. So in healthcare, I like it because, number one, it's something that you're never going to run out of customers. It's an industry that is never going to have a down year. Obviously, the baby boomers are getting older every day. Those are people born, from, I think, 1943 to 1965. And so we're getting older. I'm 55 years old. Our group is getting older. There's more of us. And we've got a lot of issues. We have, cardiovascular disease, diabetes, you name the chronic disease issues. And so being in healthcare now for 30 years, and the last 10 years in what I call the traditional healthcare space, there's some tremendous momentum and also trends in the area of healthcare. One is called chronic care management. It's the ability for physicians to actually manage this incredible growing demand for the chronically ill or these disease states that we have in this country. But unfortunately, healthcare delivery is positioned in such a way that physicians are overburdened, they're overworked, they're understaffed, and the amount of regulatory and things that they have to deal with on a daily basis, because primarily the way that insurance is positioned, filing claims for patients. Basically, you've got patients that are walking in the door, their out-of-pocket expenditures are getting to the point where it's more than their monthly mortgage for their home between their premiums and their out-of-pocket costs. So therein lies really the opportunity, and why virtual care is what we call it at CARIE Health is really just incredible opportunity to position yourself in front of this massive $5 trillion trend over the next 5 to 7 years. And I'm going to talk a little bit about why that is. So let's just look at the virtual care industry, what they call telehealth. Telehealth, or global telemedicine, in 2015 was a $25.53 billion market, or billion-dollar business. And that's way less than 1% of 1% of the population ever having a telemedicine visit. So the opportunity is just massive. By the year 2020, which is literally 2 years or less than 2 years away, the telemedicine or virtual care market will be 57 or close to $58 billion. But here's really the area that I want to focus in on, is the year 2025. As we look out as an entrepreneur, as a business person, either in or out of the healthcare space, being able to position ourselves in front of a trend that is looking at $113 billion by the year 2025, in an industry that less than 1% of the population is ever engaged in a telemedicine or virtual care visit, is really that opportunity. And all the experts, everyone from the mainstream board certification of the American Academy of Physicians, you look at any specialty, we're seeing that telemedicine is transforming the way healthcare is being delivered. And they're saying in the Wall Street Journal that the revolution is finally here. The reason is because the demand and the need for telehealth and the actual technology that every single citizen in this country possesses today, via or i.e. a mobile health device or mobile device, a computer, an iPad, the access to high definition video or high definition audio through broadband or high speed internet has now made the ability for telemedicine to be available. And then recently, over the last few years, the deregulation of telemedicine or virtual care in all 50 states. So you couple the ability and technology just catching up with the demand. I mean, you can just look at what technology's done to almost every industry. If you've recently traveled this summer and you've been to the airport, you don't even need to see a person at the desk of the airline, you know, the person at check-in anymore. You literally go to a kiosk, you put in your credit card or your ID, you pull up, you punch in your seat, you get your boarding pass, you download the mobile device, and you literally walk through security. You almost literally can walk on a plane once you get through security, never talk to a person. So that's really what's happening in healthcare, the ability to utilize technology. On the other side, from the provider standpoint, we've got a crisis which is called the disappearing doctor. And this is an article in the New York Times about how physicians are actually leaving in droves the healthcare industry because of mega mergers and the way that the business model of medicine. You've got what we call the corporatization of medicine. You have physicians that, because they can't, their overhead, the declining reimbursement, and the regulation that they have to go through, and the way that the big payers, the Blue Cross Blue Shield, United, the Aetnas, the Cignas of the world, are actually conducting business. The average independent physician is finding it hard to actually survive as a physician in our community, putting out a shingle and actually treating us and our families. So this is really where we come into play. And because of the technology that CARIE Health, and we're going to walk you through that, and because of the value of telehealth or virtual care and the position it has in the marketplace, we're getting a tremendous amount of acclaim. In 2016, okay, our technology came in 8th place at the South by Southwest Technology Conference. The South by Southwest Technology Conference was here in Austin, where I actually live. I actually put some physicians in front of Matt when he was here in Austin to present at that technology conference. This is where Google, this is where Facebook, this is where companies like Uber were actually launched or had some of their debuts. And again, we were actually previewed at the Emerge conference in Miami. The Silicon Review, which is a high-tech magazine, basically featured Matt Wanderer, our CEO and founder, and my friend on the front page. This is just the article. With the digital on-demand platform, CARIE Health is reinventing the concierge care experience for all patients across this country. And that's what we're going to talk about, how CARIE Health is not just a virtual care opportunity or a platform. It actually allows physicians the ability to actually build a concierge-based platform or practice alongside their traditional insurance reimbursed practice. And that's really the future of medicine. The future of medicine is building a hybrid practice, concierge-based, membership-based, having a virtual care opportunity to treat your patients virtually along with your traditional healthcare practice. Let's talk a little bit about virtual care and why telehealth or virtual care is becoming and will be the future of healthcare. The reason is because most of the common conditions, all of those conditions that you see here on the right-hand side. So let's just think about the last time you, a family member, or somebody that you knew or know actually visited a primary care or urgent care practice. Maybe it was allergy, asthma. Maybe it was because they had a stomach ache or they had some type of GI issue, a headache. Maybe they have hypertension. Maybe they had an issue, a cardiovascular issue, diabetic issue, or just something simple as maybe a flu, influenza, or maybe just a cold or a cough. All of these types of issues, the acute, non-emergency based issues, could be treated by virtual care. As a matter of fact, 70% of all acute care and urgent care visits could be handled safely and effectively over the phone or video. I mean, think about what we do today. Those people today, we don't even talk on the phone. We literally FaceTime. We do. People do Instagram, Facebook. I mean, social media, because the ability with high definition video and audio, it almost is like you're just there in person. And all of the patients, less than 1% of the patients, but it's still millions of patients that have had a virtual care or telehealth visit. said that their actual experience was as good or better. 91% of them said as good or better using telehealth, a telehealth technology like CARIE. Why? Because you didn't have to leave your home. You didn't have to take off work. It saved you money. It saved you time. And the physician practice loved doing it. Why? Because they didn't have to take up and spend all the overhead of you actually going in the office, filling out all of the forms in the office, and having 3 or 4 employees file that claim. So it was actually very beneficial for the practice. And it saved you money. Why? Because the average cost of an individual to an urgent care visit with insurance, ladies and gentlemen, is $155. Why is it $155? Because you had to pay out of pocket because you did not reach your deductible in most cases. $5,000, $7,000, $10,000 deductibles. So you didn't have to wait either. So when you take all the features and benefits and the way that you, and all of the conditions that you can see a physician for virtual care or telehealth, it's an absolute, what we call no-brainer. It's a layup of why virtual care is the wave of the future of medicine. The benefit to the patient, 24/7, 365 days a year in all 50 states. Like I mentioned, you don't have to leave home. You don't have to actually hire a babysitter or call your parents or a loved one or maybe a neighbor to come over and watch your kids or drag your kids to the doctor. You don't have co-pays because in our model, our membership, it's an all-you-can-eat buffet, $29 for an individual, $49 for a family, $600 a year to be able to have access 24/7. And you're going to see with the CARIE Health platform, eventually, potentially, you have the ability to deliver this to your own personal physician. I predict in the next 12, 24 months, every independent physician practice in this country will be exposed, and most will actually make the decision to have the CARIE Health platform in their practice and virtualize their practice and develop a concierge-based virtual practice. Why? Because it's free to the doctor. You know, my partner and I have been in the ancillary healthcare space for over the last 30 years. The last 10 years, traditional healthcare. And I can tell you, our number one box that we check of the ancillaries that we deliver to doctors is, what is the barrier of entry to the doctors? In CARIE Health, it's zero. Why? Because it's a free platform. And why would the physicians get excited about virtualizing their practice and adopting and signing up for the CARIE Health platform? The reason is they have no choice, because if they do not virtualize their practice, I can tell you that they are going to lose their patients to the big payers, the United, the Aetna, the Cignas, and the Blue Cross Blue Shields. Why? Because they're all going virtual. They're teaming up with companies like Teladoc or MD Live, and then partnering with CVS and Walgreens with their own mini clinics. What they are trying to do, and in the process of doing, is saying, don't go to your doctor. Let's take out the independent local physician. Have patients go directly to CVS or Walgreens or Walmart or Costco, see our doctors in those mini clinics or those urgent care clinics within those big box stores or pharmacies. You can get your script, and then we'll use what we call our doc in a box or our call center doctors at Teladoc or MD Live, and then get rid of your own doctor. But the challenge is that patients still value the personal relationship with their own physician, people that know them, that go to the same schools as their children, that live in their communities, that work out there at their gyms, that go to their churches, that live and walk around their grocery stores, people that know them and know not only them, but maybe their parents and maybe their grandparents have raised their children. We want our local pediatricians, our local primary care, family practice, and specialists that we know and love and trust to actually see us, and then also see us virtually. And it allows physicians to actually get paid for what they've been doing for years, which is seeing their patients instead of just picking up the phone and calling in a prescription, which is not compliant. They now have the ability to do that and monetize that. So the physician benefits is vast, okay? Our model is absolutely free to providers. It's a self-provisioning model. We're launching CARIE Health in our platform in October. And what we're doing now is we're in the pre-launch phase of actually driving and enrolling our doctors into what we call our CARIE Health platform waitlist. And that's what we need to be doing as we speak. building thousands of physician practices on the wait list so they can launch. Okay, and Jeff's going to walk you through what the value and the benefit is to the practice, but more importantly, what the value is to the patient and to you. If you engage in this business, there's an opportunity to earn tens of thousands and even potentially hundreds of thousands of dollars a month if you do this correctly and you understand the value of virtualizing practices all over this country and building a virtual care concierge network, which is, I think, the future of healthcare. It's a seamless practice integration. It integrates with all of your EMR, the physician's EMR, EHR, integrates with their scheduling system, and also the big clearinghouses for the SureScripts and Express Scripts network. The model in the platform is completely customizable, and it can be branded with the physician, each individual physician practice. They have their own unique URL. Patients will be able to find their own doctors that enroll in the virtual care network with CARIE, and they're going to be able to upload their logo, their photos, and they're going to personalize their virtual practice. It has an amazing dashboard that allows practices to create what we call a virtual waiting room. They're in complete control of their schedule. They can not only enroll their own patients into the membership of the single or the $29 or the $49 membership and then manage those patients, but also their whole patient population as a whole, market to their patient, the patient practice, to their patient community, and start to build this virtual care practice. Jeff's going to walk through that opportunity. So the dashboard is very robust. It has their virtual waiting room. You see how many patients are in the queue. They can actually let their patients know, let them know what time their actual appointment is, validate that appointment. Again, next slide. The physician is going to be able to see and have access to all the patient demographics, and with the online patient intake form, see why the patient actually is seeking a virtual consultation. And of course, the fact that they're actually, have seen that patient before. In most cases, if it's their own patient, they're going to have all of their patient records there on file. So it's just an amazing opportunity for a physician to literally overnight virtualize their practice. And I can tell you that I've spent the last 30 years in healthcare. I've sat in thousands of practices, understand practice ecosystems, the value and where the opportunities lie within healthcare today, within these primary care, urgent care, within these specialist practices. And there's no doubt in my mind that CARIE Health will be a service, will be an opportunity, of technology that every provider will want to implement. So what I'm going to do is turn the call and the webinar over to Jeff Giammalva. Jeff has been my partner in multiple ventures. As Jeff mentioned, him and Lisa were our #1 earners in our company, my company, where we deployed 6,000 practices with evidence-based nutrition. And Jeff was our #1 earner and mobilized thousands of those practices and built a massive organization and team. Him and Lisa have been leaders. They're experts in the area of sales and marketing. And so what I would do is just sit back and listen to Jeff walk you through the opportunity that you, your friends, family, and your colleagues have by engaging with the CARIE Health Opportunity Platform. So Jeff, I'll turn the call over to you. I appreciate you having me on the call tonight and look forward to listening to you walk through the opportunity.
All right, Lou, thank you so much. I appreciate it. And as always, man, is that not crystal clear, everybody? I mean, if someone said to you, can you please explain the CARIE opportunity? And they sat through that, I get it, I see it. And there lies the opportunity. It's identifying that problem and then putting a way to help physicians solve that problem. So what I want to do now is just really walk you through, okay, what this can mean for you if you decide to take this step and really join the CARIE Health a family of virtual care consultants. So first of all, what I want to share with you is what this could mean for you. And it starts with really the opportunity to own your own business. A lot of people out there today are entrepreneurial. They don't have the financial wherewithal. Maybe they don't have the know-how, and most people certainly don't have the time. Here, we give you that opportunity. And with that, no employees, no traditional overhead, a system you could leverage, and also the same tax advantages that you could take advantage of as any other business. We also provide people something very important, and that's the ability to start earning immediate income. We live in an instant gratification society. Man, we want to eat now. We want to go somewhere, we want that car in 5 minutes, right? We start an opportunity, we want to earn money tomorrow. Well, we give you that opportunity. It's just a matter of now defining it for yourself. Are you looking to supplement your income? That could mean covering a car payment, a mortgage payment, a child's tuition. For people that want to be a little bit more aggressive, we're putting people on business plans to make $100,000 their first year. And I know without a doubt, because of my experience in this industry, we will have 7-figure income earners. Now remember your income disclosure. But I will share with you, most people start this spare time, part-time. They can't quit their day jobs, and we understand that. But eventually, the advancement opportunity kicks in. People start to think about being paid what they're worth, right? Having no glass ceiling. They start daydreaming of firing their boss because they see the potential here as they do something just spare time, part-time. So the advancement opportunity really is a way to transition, a way out of what you're currently doing if that's something you want to have done. And the residual income is very important. I know we have a lot of very successful people on this call financially. And I know every successful person understands the concept of residual income. It's doing the work once and getting paid for that work into the future. There's 2 ways to earn it. One way is off your money or your investments. The other way is to get a percentage of other people's actions. So if you really are looking for time freedom and money freedom and a secured retirement, you have to stop eventually trading time for dollars. The CARIE Health opportunity gives you a way. And the way we do this, and what we really pride ourselves on, is our system for success. What you saw tonight is not on trial. We have people with over 100 years of experience in this industry. We're going to give you turnkey programs. We're going to offer you personal and group coaching. We're vested in your success. There'll be a weekly calendar of events that you could leverage, mostly online, and a social media platform that will allow you to build a business throughout the United States. So this is the opportunity. So when people are making their decision, they're making a decision based on, do I believe CARIE Health has the ability of solving the healthcare crisis? And then this is what it can mean for you as an individual. And it all surrounds this pre-launch opportunity. And I'm going to be very candid. The good news is we're brand new. The bad news is we're brand new. So that's why I said in my opening, we're looking for that unique individual that has the ability to see this before it happens. Where do you think you make more money? Before the 35,000 doctors joins our team or after? Well, this is what pre-launch is. It's $399 to become a certified, to get your certified provider license, and your entire overhead, I know this is comical for some of you, for your business is $99 a month. That's what you pay to become certified solution provider license. That is our product. So you get your enterprise license. You get the training certification. You could deploy as many doctor practices as you'd like. There'll be a marketing assist program and a lead generation program for our top producers. So we want to make this very simple for people to say yes. This doesn't require hundreds of thousands of dollars like a traditional business. That is your only cost. $399 and $99 a month. And everything that we do and everything that we earn comes from people taking advantage of our memberships. To become a member with CARIE Health as a single individual, it's $29 a month. For a family up to 5, $49 a month. It's easy for that customer or that patient to register. As soon as they register and they choose their membership, they could start seeing their doctor 24 hours a day, 7 days a week. Virtual. If a prescription is needed, a prescription is written and sent to the pharmacy of their choice. Simple. All commissions are based on the number of memberships that you have in your organization. So what I want to do now is transition and show you just a couple of business plans just to give you an idea of what's possible here. Because when you go out there, there'll be some people on this call that say, you know what? I'm going to get involved and I'm going to go out there personally and I'm going to secure as many doctor practices as I can. Great. Other people are going to want to build a team of virtual care consultants. So now they have a team of people going out there and deploying the doctors. This is a choice that you will make. I do know doing this as long as we have in this industry, it's much better to earn a percentage off a team versus 100% off your efforts. So just to give you an example, and I know we have some very successful networkers on this call tonight. Let's say you went out there between now and October and you brought on 40 people to be part of your team. You personally brought 40 people on. Well, you got to understand, those 40 people start paying $99 a month. Since that's our product, you get paid on that. So just by bringing your initial 40 people on, and you can play with these numbers any way you want, you just secured and put together a $792 residual income per month. Just off the people on your team paying the $99. Now let's say those 40 people went out there and got 3 people each. Now you got 120 virtual care consultants and an $1,100 residual income coming from that group. And if everybody went out there and just got 3 people, right, you put together a team. Remember, you found the initial 40, but as geometric progression kicks in, some form of this happens. In this example, you have 4,800 virtual care consultants on your team. And you put together a residual income for you of $13,000 a month. Now, I want to make a very important point here. We have yet to deploy a doctor. We have yet to sell a membership. We've just put together the team. That's all we're doing right now, is we're bringing on team members and we're securing doctors on the wait list. But now we go live. And now you have 4,800 people on your team going out there to secure the physician practice. But I want to share with you something now. See, these are where the memberships kick in. I know from my experience, 4,800 people are not going to do what they're supposed to do. In fact, in my example I'm going to show you right now, let's say 2/3 of your team did nothing. 0, zilch. But 1/3 did a little. 1/3 went to work. And let's say they each got 1 doctor practice. That's 1,600 people, right? 1/3 of 4,800 is 1,600. They each got 1 practice. Now I'm going to share with you the difference here tonight. Each doctor practice represents from 2,500 to 4,000 opportunities. Because each doctor's practice has 2,500 to 4,000 patients on average. So let's take 2,500. If I have 1,600 people getting 1 practice and each practice has 2,500 patients, that's 4 million patients that we're going to start marketing to. that their doctor just went virtual. Let's say we had a 5% conversion rate. 5%. We believe we could get our conversion rate to 30%. That means you now have 200,000 patients on our membership. In this example, just to expand your vision, whether you believe it or not, it's just math. That's $152,000 a month that you would be earning. If we had a 10% conversion rate, that would be $300,000 a month. You can play with the numbers any way you want. The big difference here, and I want to emphasize this, one doctor, 2,500 to 4,000 patients. So if you want to look at what that looks like, okay, just another example, guys. If you sponsored one doctor and they had 3,000 patients, just showing you another example here, with a 10% conversion rate, 300 patients on the $49, that doctor is generating this amount of money on the memberships. You would be earning $1,400 a month per practice. Think about that. 10 practices, you're making $15,000 a month. And if you went out there and just got 5 other VCCs on your team and they got 1 practice. See, I'm not showing you 40 now. I'm showing you, you got 1. You started and you got 5. And those 5 each got 5. What if you had 155? Forget 1,600. 155 total physician practices in your network. $52,000 a month. Now, I showed you different business plans. So I know the average person who gets involved with our business, an extra $3,000 to $5,000 a month in residual income changes their life. With what we're about to roll out, how hard do you think it would be to put together a business plan to make $5,000 extra per month? If you want to see beyond that, hopefully we expanded your vision here tonight. But I will tell you, as a company, we will secure 35,000 doctor practices in 18 months. And those 35,000 doctor practices are going to be in somebody's organization. And this is why pre-launch is so important. So if you like what you've seen tonight, let me share with you now in the next 3 minutes on how to best position yourself and get started, and how to start earning money right away. First thing you want to do is you want to get started, get with the person that got you on the call, get in the system, right? And what you want to do is you want to become 50% pro qualified if you're going to build a team with us. To become 50% pro qualified, you want to bring in your first 2 people within 7 days. These are virtual care partners. These are people that are going to help you, right? These are people that want an opportunity just like you. If you do this in 7 days, you lock in a 50% immediate income every time someone joins your team. So when you bring in person number 1 who starts for $399, you make $100. You bring in person number 2 who starts for $399, you make $100 immediate. If you do this in 7 days, every person you add to your team that starts, you make $200 per person, and that's locked in. We want to make sure we put money in people's pocket very quickly. If you don't do it in 7 days, you got to bring in 5 people over any length of time to lock in your 50% immediate income. That's your first step. So get started, enroll as a virtual care consultant, $399. Person who got you on the call will send you the link. And all you want to do now is you're going to have access to our introductory video. You want to copy and paste that video and send it out to as many people as you can, telling them about the CARIE Health opportunity. If they show an interest, all you have to do now is lead them to the information. And that information can be given to them on a webinar like this. And I'll give you that schedule here in a second. It could be done through a recorded webinar. This is being recorded. You could send this to your prospect. Or it could be done through a three-way call. All you have to do is send this out, and when people want more information, leverage the system. So every Sunday, Tuesday, and Thursday at 6 o'clock, we do these overviews. Tuesday is a physician overview. This is a business overview. So on Sundays and Thursdays, we do this, and this is tailored for the entrepreneur that wants to build a business. Tuesday is for the physician that wants to understand how the platform works. And you'll get all this information once you get started with us. So once again, take advantage of this pre-launch opportunity. Okay, this is where we are, and this is where we're going. Hopefully, we expanded your vision. And if you like what you saw tonight, simply get started, and we want to welcome you to the CARIE Health family. Appreciate you. I thank you for taking your Sunday night, and I look forward to seeing everybody on the call Tuesday night. Appreciate it. Thank you, guys.